Hello, everyone. It's Monday, July the 13th. You know, if you've been paying attention to the news, it's been a long, long weekend for our nation. At one point in time, we recorded 66,786 new COVID active cases in a day in our nation. It's been a long weekend as well for West Virginia. And we see our numbers continuing to move in a way that is not becoming of the way we want to go. And I'll get into that in a few minutes. We've lost another great West Virginian. We lost a West Virginian a year younger than me. And we lost a 68-year-old female in Ohio County, our 96th death. You know, I keep saying the same thing over and over, but I just can't imagine that I would pick up some virus that would take my life, and yet it could. And yet it's continuing to do that all across our state. We've lost 96 great West Virginians now. We surely want you to remember each and every one of them in your thoughts and your prayers, as Kathy and I surely are. But in addition to that, we want everyone to know that this is not playtime stuff. This is not a time to be macho and stand up and say, well, I don't have to do this, or I'm not going to do this, or not going to do that. And at the end of the day, end up in a situation just like I'm sure a bunch of Mississippi legislatures have already done. And I think the number is 1 in 6 of them are now infected. And so we don't need grandstanding. We do not need macho now. We need absolute bravery. We need sincerity to protect your neighbors. We need to really, really be smart. Now, again, I hate like crazy for the family, for the lady, a 68-year-old that we lost in Ohio County. Please remember her and that family and all of her other loved ones in your thoughts and your prayers. You know, we now in West Virginia have 1,338 active cases. We have grown 206 active cases since I saw you the last time on Friday. We are in great shape still with our hospitals, but we're no guarantee that it's going to stay that way, are we? We have 62 people that are now currently hospitalized. Mon County has now, of the 1,200 or 1,300 that we have statewide, Mon County now has a fourth of those. They have 340 active cases in Mon County right as we speak. They have grown nearly 194 since Friday. Now, the astounding thing is, what is the age category in which they're growing? They're growing absolutely at an alarming rate from the age of 20 to 29 years of age. That level today is at in Mon County is at twice the level of any other age group. Now, we still have fewer cases in our state, fewer hospitalizations, fewer deaths. We still have so much to be proud of, but again, now you count on me. You count on me to do my job. It's no fun. It's no fun to close things and make mandatory masks and somewhat divide us and all those things. But this is a no fun time. And we've got to do the things that are absolutely going to be the prudent things for all West Virginians for us to be able to still do in West Virginia many of the things that we love to do. And maybe we're inconvenienced, so what? And at the end of the day, we're surely trying to preserve the economics of our state, your jobs, your future, and your dreams. Now, in Mon County, we've got to do something. Now, because you talk about a hot spot, it is a real hot spot. I'm going to read to you 2 or 3 things here, but we continue to watch Mon County's numbers very closely. We just got off the phone with the health officials, the county commissions, everybody from Mon County, and they're working. They're trying really hard, and we're going to try to integrate their ideas with our ideas as we do all over the place. And our health experts are with them and in contact with them in every way. And we're going to work hand in hand with them, with the exception of one thing. That one thing is just this. Today, I am ordering the bars in Mon County to close for 10 days. And during that 10-day period, I am very hopeful that what's going to happen is we're going to begin to see a correction in the numbers. But what we've got going on in Mon County is we've got a tremendous amount of students that have now come back, and we have got a situation in the age group from 20 to 29 years of age, and absolutely, it is an issue and a problem that if we just say, well, we're going to study this for a few more days, maybe even 2 more weeks. Please follow my math. For every day that we miss, many, many, many people that are non-symptomatic or asymptomatic are going to affect others. Remember my math on Texas. Just imagine that probably a little over a month ago, Texas was West Virginia. Today, they have a runaway situation to where their hospitals are overtasked. Do you not believe that Texas's hospitals are probably much more numerous? Now, surely they've got more people, I got it. But do you not understand that really and truly, if things turn south on us in a great big way, our rural hospitals would struggle. Absolutely, we would lose people after people after people. Now, with all that being said, so what we're going to do, we're going to close the bars in Mon County for 10 days. During that time, what we hope will happen is the local health officials, the county commissions and everything else will help those bars in every way to be able to comply with exactly what is already up on our websites. It's what we mandated when we closed the bars and we opened and did all that stuff before. Now, we'll watch the numbers and we'll be very, very concerned. Now, I'm going to read very quickly to you. There's a rise in active cases, and the number of community-based outbreaks is extremely concerning in Mon County. With their current active cases at 340, we must act and we must stop something and stop this right now. Students are coming back to school, and the huge threat is the students congregating at the bars. Now I want to show you just a little map here that Dr. Marsh just gave me a little while ago. This has got on it the highest risk, the moderate risk, and the low risk. The highest risk of all, the highest risk of everything, going to a bar. This was put out by Texas. Going to a bar, the highest risk of all. Now, where would you think the restaurants would be? Eating at a restaurant, all the way up to here. Highest risk here, eating at a restaurant here. Now, what we're going to do is close our bars in Mon County for 10 days. If you have a bar in a restaurant, we're going to close the bar in the restaurant. We still have no problem whatsoever serving alcohol in the restaurant while you're dining there and you're having your meal. But absolutely, for right now, the restaurants we're going to leave the same. The bars in Mon County we're going to close. As far as additional closings, and all this will go into effect at 12:01 tonight. As far as additional closings, we have got to significantly restrict the crowd size again. We went to 100. We're now going to go back to 25. As far as being effective tomorrow, any fairs, festivals, or outdoor concerts, we're not going to have them. We're going to close. And we're going to, like I said, we're going to go back to a crowd size of 25. Now, I've got to talk to you just a second about churches. Look, I'm a Christian, and I'm really proud of it. And I truly understand the importance of church. And I understand that it is the highest priority in our lives, and I get it. I get it. You know, I just got this just a few minutes ago, and you won't be able to see this, and I'm not beating on anyone. This is a church setting that we just had in one of our northern counties, and there's no one that I can see anywhere in the congregation that's got a mask on. There's no pews in between. We're just asking for it. You see, there's no question, I don't question our love, but at the same time, we cannot keep doing this. We just can't. Now, our health departments, you know, surely have authority to overlook this or to watch after this. I can tell you without any question whatsoever that I don't have any powers to put somebody in jail for not wearing a mask. You know, that would be something that would have to be legislated, but our health departments, in regard to our restaurants and our bars, do have authority to absolutely oversee from the standpoint of all the licensing. You know, I just would tell you over and over, from the standpoint of our churches, you know, my home is in Greenbrier County. And at a church in Greenbrier County, we had exactly the same situation happen. And I said it would be a miracle if we didn't lose someone that was there. And we did. And then we did. And I think we maybe even did again. Not to mention maybe some side effects or whatever that may trail people forever. Because there's everything that happens from this. There's blood clots, and there's amputations, and there's strokes, and there's heart attacks. There's everything other than deaths, too. I can't possibly imagine that what we would do as West Virginians we would go into church settings today and not wear masks. Do you realize that in Florida, not long ago was bragging, and they were on the nightly news every night, Their governor was just hot as he could be, talking about how great everything was in Florida. Do you realize that day before yesterday, in Florida, in one day, they, I think, exceeded the highest total in a day, I think, in New York City. And I could be wrong there. And I think Dr. Marsh will clean this up in just a few minutes. But in addition to that, they were the fourth all-time of any nation of what Florida did in one state. They had 15,000 plus positive tests in a day. What are they going to do? What are they going to do? They have the best hospitals. Surely they've got more population than us, but they got water around three sides of the state. What are they going to do? You see, we don't have water around. We've got people around, all the way around us. What would happen to us? So please, churches, please understand, my order is mandatory for buildings outside of your home. Absolutely, it is mandatory that you wear a mask in church. And it is only the smart thing to do. Now, come on. We're going the wrong way here. And we've got to get this thing turned around and going the way we want it to go. As far as our small business grants, I want to read this whole thing to you also. But any West Virginia-based small business in existence on February the 29th, 2020, with 1 to 35 employees will be able to apply for the grant that we're talking about, starting with $5,000. Guidelines for the grants have been up on our screens. You must register as a vendor with the state before you can apply. The full application will be available on the website, I hope, this afternoon. The only thing to add to that is our state auditor, J.B. McCuskey, has been in contact with me and all of our people and has brought different things to our attention. These things all are about the sole proprietorship or self-employed small business owners that are currently not eligible. Now, we're working through all of this because we want everyone to be eligible if we can possibly pull that off. But the way we're working through this is because there is no other way to be able to oversee it that we can possibly see today. If you do not have an employee, even if it's yourself, registered with Workforce, then absolutely this becomes a nightmare of nightmares to prevent fraud and everything else. It was always our intent to have now, we started with 5, but we lowered it to 1, and it is always the intent to have 1 to 35 employees. We're working through the details with our state auditor. JB's doing a great job, and we're working through all those details, and we're going to get them out just as fast as we possibly can. Now, one other thing that needs to be said is, because there's some confusion on this, is the EFT part of the application or the process is no longer mandatory to receive the funds. EFT is no longer mandatory to receive the funds. And the other thing is, this application process will run all the way through September the 30th. And so as far as, the idea that everybody's got to get their application in today, we want them to try to hurry along and get the applications in, and then we'll send the money out and everything. But you've got time till September the 30th, and the money won't change and everything. And so just know, all the other details. As far as Workforce West Virginia announced today that any worker who has now exhausted their regular state unemployment and pandemic emergency unemployment compensation benefits may now apply for extended benefits. Under the federal law, extended benefits offer up to an additional 13 weeks of benefits to workers who have exhausted their regular unemployment benefits and 13 weeks of PEUC assistance. To apply for this extension, visit our website, and Director Scott Adkins will be on the call today, if there's any questions that need to go his way. Now, real quickly, one thing, that should be brought up is if you're having a fair and a festival and you can do so with a gathering now size of less than 25, great. We're absolutely great with that. But the bottom line is we can't bring together groups in excess of 25. The free testing will be going on this week in Harrison, Barber, Mercer, Berkeley, and Jefferson counties. This should be up on the screen. The first testing event is tomorrow in Harrison County. That's really the second go-round that we've been there and everything, but the first testing event was from noon to 7 o'clock. That's what we'll be doing, I guess, tomorrow. The testing in other counties, Thursday, Friday, and Saturday, will be coming up and everything, and this testing, of course, is free to all people, and we really want to target our minorities and our people that that are the most vulnerable to come out. I'm not sure exactly what this says here, but it says testing in other counties Thursday, Friday, and Saturday. I guess are still to come, but Jordan, if you could help me out a little bit there as to what in the world does that mean?
Yeah, so the testing is July 14, 16, 17, and 18, and the dates are on the screen with the corresponding counties.
Well, I don't have the dates on mine, but if you'll follow what's up on our website or check our website and everything, you can go from there. As far as our monies that are going out to our cities and our counties and all that kind of stuff, we've got nearly $40 million now that have gone out. 145 cities have applied, and we just urge you to continue to apply, and we'll send out more and more and more dollars. We've targeted $200 million. We've got 40. We're a fifth of the way. Please continue to apply, and we'll get that money out, and we'll get it out per the guidelines. We now have in our summer feeding program, we've got 690 sites, and if you have an issue about how to get food and everything that maybe that you just can't understand on the map where to go and all that kind of stuff, call us. Call 211, and we'll give you some assistance there. I remind you again about the census. We've got to have everybody counted. I've been through that over and over. And the income tax filing deadline, I wanted to, again, it's not great news, but that is Wednesday, July the 15th. If you haven't filed your taxes, please remember to do so by Wednesday. And the only other thing I have right now is a DMV extension, and that is the West Virginia DMV announced on Friday that they are once again extending many driver and vehicle transaction deadlines to September the 30th. And this includes driver's license and vehicle registrations. And please visit the DMV website for more information. Now, I want to go back to our fairs and festivals one more time. Statewide, our fairs and festivals now are closed with the exception of this. If you can limit the crowd size to 25, we're good to go as far as our fairs and festivals. But this is a statewide thing to where you have got to limit to 25 people in a crowd. Again, I wish to goodness that we didn't have to do any of this stuff. I wish that we had a vaccine now and we could be West Virginians and enjoying this summer beyond belief, just like you. But you know what I'm glad of? I'm so happy today that we're not Texas and we're not Florida. And you do not need to have me here reporting on thousands or hundreds and then maybe thousands of West Virginians that we've lost. It can happen. It is happening. And we're watching it every single night on TV, and we're saying to you, here's your answer right now. This is the only bullet in the gun right now. Now we've had to close our bars in Mon County. We absolutely will move forward with doing anything we have to do to ensure and protect ourselves. This is your bullet today. You have been the miracles, I've said over and over. Please, please, let's not be Texas or Florida. Thank you so much.
All right, thank you, Governor. Now we'll go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. It's great to be with everybody today. I want to reinforce a few things that the governor has brought up. You know, as we had discussed before during this time of reopening, that we look at this as the dance phase of what we're trying to accomplish with the coronavirus, where we're trying to learn to stay in harmony with the virus. But we know that as certain metrics change, and the metrics, again, that we're using is watching that RT value, of which we have been first or second highest spread from the reproductive number in the country over the past few days. We look at the number of positive active cases, and we've seen that almost double over the past 10 days or 14 days. And as the governor said, we have now 340 active cases in Mon County. We look at that rate of the total number of cases that are positive, and we've seen that rate go from around 0.5 to 1, now over 3 to 5% over, many of the days of the last week. And then we look at the hospital data, the ICU data, and as the governor has alluded, we look around the country and we see states that are really, really having problems. Florida had 15,000 cases, as the governor yesterday. As the governor said, if they were a country, they would have reported the 4th highest number of cases of any country. And if they were on the list of cumulative, they'd be 10th on the list of countries. So ultimately, as we see these effects that are going on in a number of states, including some of the states around us, we are noticing consistently, as the governor has articulated in West Virginia, that younger and younger people are becoming affected. And these people are now being hospitalized. They're finding their ways to the ICUs. In Florida, about 55 hospitals have run out of ICU beds. In Texas, they've reported full ICUs in parts of the state, as has Arizona, as is California. So as we look at being very aggressive, as we are reopening West Virginia and the comeback, we've known since the very beginning, no surprise, that there's going to be many times that we can walk forward, and that's what we've been doing. But sometimes we've got to slow down and stop and maybe even take a step backwards as we look at those precise counties and areas of West Virginia that are being affected differently and perhaps more than other parts of our state. And we see Mon County as really that county right now. And as the governor demonstrated, as we look at areas that really make the risk much higher, certainly bars are one area that has been associated with outbreaks, not only across the country, but also here in West Virginia, and some of the outbreaks trace back to bars in Mon County. But also as we look at crowds and look at issues where people are close together inside those 3 C's that we've talked about, I think the governor has been very wise to put a hold temporarily on that area of congregation and facilitate and make sure that we are preparing ourselves well and seeing that general rate of spread go down both in Mon County and in the state. Similarly, the governor mentioned church services, and we know that churches are places of immense importance for all of us as we go to worship and share our faith, but also because of the indoor setting and the singing and the person-to-person contact. These are also places that we've seen in West Virginia as well as nationally where there can be very large outbreaks. And big churches with large congregation sizes are another very important area of potential spread. And that's something else that we want to make sure that people are really, really good about wearing their masks. So from our perspective, we have seen that West Virginia has remained very active in community spread of COVID-19. We want to be very aggressive in starting to reduce that rate of spread, reduce the surge, keep flattening the curve, and protect each other. And people are really stepping up in many places, as we understand it, to wear their mask and do that really good physical distancing. Remember, these work together. You should do both. You should still wear a mask and physically distance when you're inside, when you're around a lot of people, and when you're around people in a consistent longitudinal manner for greater than 15 minutes that you don't live with, then mask and distancing is really important. So we'll continue to follow closely and report as we determine the different areas of the state where COVID-19 is spreading more rapidly. But as we've said before, the key is for each one of us to do the right things to protect ourselves, protect each other, protect the vulnerable citizens of the state. And to that end, I think people in general have done a tremendous job, and we are so appreciative of that. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer.
Got to come back to me just for a second, okay? We've got a misunderstanding or miscommunication, and it may have very well been all on me. But in regard to our fairs and festivals and our outdoor concerts, we feel like naturally it is impossible for us to regulate a crowd size at an outdoor festival or fair or concert. And that is the absolute breeding ground where we absolutely could have all kinds of problems. I've said to you that we don't care if you've got a fair or festival with 25 people and everything. Well, if you've got a fair or festival that you can socially distance 25 people and everything, we're fine. We're fine, absolutely. But for the most part, our fairs and festivals and outdoor concerts, we're done with in West Virginia for right now. The other thing I want to make really clear is just this. This does not pertain to, outdoor pools, little leagues or sporting events or whatever it may be. Provided that you can adequately social distance, wear mask. I would highly recommend to wear mask. Absolutely, this does not pertain to that at all. What this pertained to, and where I made the mistake by telling you 25 at a fair and festival. Fairs and festivals, for all practical purposes, are gone. Outdoor concerts are gone. Absolutely, this does not apply to the Little League. It doesn't apply to an outdoor pool, provided that you can social distance. And that's the whole key to everything. It doesn't apply to soccer. Doesn't apply to our SSAC and our guidelines through the coaching period that they're in. It does not apply to those whatsoever. It was just directed at our fairs and festivals and outdoor concerts. But I want to clean that up, Jordan. That's my fault.
All right, thank you, Governor. Now we'll go back to Major General Hoyer.
Good afternoon. Highlight some of the recent testing. This past weekend, 5,500 West Virginians were tested in multiple test lanes with the National Guard, DHHR, local health partners, and counties and volunteers. Just to give folks an example, a normal community-based test lane would average about 1,000 people. In Monongalia County, we averaged 3,000 people. We did have some folks who did not get tested, and the governor has directed again that we follow up and do additional testing in Mon County, and we will work this week to execute that testing in coordination with local partners. We continue to refine data to give the governor the best picture possible. We are working hard to continue to maintain direct contact with the Hospital Association. They're a great partner. We are managing data related to hospital use rates to make sure that we stay focused on that, as well as with hospitals and long-term care facilities on PPE burn rate, as PPE has now again become a national issue related to shortages. Two last items. We did restart the Mountaineer Challenge Academy at Camp Dawson with a substantially reduced footprint class, significant testing criteria, and significant stringent PPE and social distancing. We have children that we needed to get back into the program, and we're working diligently to take care of them and our staff. Last thing, Governor has directed that the National Guard be prepared to support state agencies for the Small Business Grant Program, and today we will prepare a group of personnel to be available to surge related to the Small Business Grant Program. Thank you.
All right, thank you, General. Secretary Bill Crouch from the West Virginia DHHR, Dr. Ayn Amjad, our State Health Officer, and Scott Atkins, the Acting Commissioner of Workforce West Virginia, are also joining us today and are available for questions. Now we'll go to media questions. The first today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, does the 25-person limit apply to church congregations? And, given the First Amendment and, freedom of religion, what powers do you have to limit church gatherings?
Charles, it does not apply. We designated that the churches were essential functions before, and so it does not apply. But all the guidelines that we have there for churches are already there. Every other pew, wear mask, all those things are there. And all we ask for is just this, is that people need to understand the danger that they are exposing themselves and all kinds of friends and relatives beyond that setting. We absolutely ask them over and over and over to please, if at any place on the planet we should be loving our neighbors, it's right there. And I don't mean from the standpoint of loving our neighbors that are there. I mean loving our neighbors as we are supposed to do through the good book that we have and everything. And by being in a church setting without a mask on today, with what we have going on all across our state, is exposing us and exposing our neighbors. So please, let's really, really bear down on that.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, when you start talking about closing things up, if the rest of the state doesn't respond, when we see the numbers coming in later this week to the mandatory mask order, what is the possibility and what are the odds that you'll start closing things down in other areas of the state which are experiencing minor or major surges? And as a side note, what is the feedback you've gotten on the mask usage, either by your office or by people calling in, about how people are complying with it? Thank you.
Well, Kenny, let me say this. Right now, our overall statewide numbers are still really good. And if I were to put a percentage basis on it, I would say that we statewide are in a good spot. It can get really bad, and I'm trying to prevent that from happening to us. But from the standpoint of likelihood of us going back to a stay-at-home order and shutting businesses down and everything else today, we're a long, long ways from that. And that likelihood is not very great. But we've got to know, and I've said it over and over and over, I will do my job. And it is not, surely it's not pleasing, it's not popular and everything when you've got to shut something down. But if that be the case, and that is coming to me from the experts, and the experts are our medical field, the experts are all the knowledge we have from the federal government. At 4 o'clock today, There's a call every Monday. I'll be on a call with the vice president at 4 o'clock today. We are absolutely seeking knowledge and information from every avenue we can possibly seek it. Now, with all that being said, absolutely, without any doubt, we have to continue to watch, but I really believe that we're not going to have to get that radical towards the rest of our state and only towards just hot spots. And again, I can never in the world thank our businesses enough for what they're doing and how they're stepping up and trying to help us. Now, Kenny, the second question you ask is, from the feedback we're getting, what kind of percentage of the feedback would be positive and negative? And I'm going to tell you, Kenny, this is just how I feel. And that is, we're not getting any feedback from people that are pushing back from the standpoint of not wearing masks. Overwhelmingly, if I were to peg a number on it, in fact, I just did this earlier with the people that I was meeting with, I said, I'll bet you that 90% of the people within the state of West Virginia today, if they were polled, would say, we're good with wearing a mask. If that protects our neighbor and it protects ourselves, outside in a public building and everything, that we're going to run in and shop for 30 minutes and then leave, we're good. We're good with doing that. And you see it all over the place. Our businesses are stepping up everywhere. If you go to Target or go to Walmart or go somewhere right here in the city of Charleston, and you'll see a different step, a completely different step. You may very well see someone in the store that doesn't have a mask on. And there are those that are, I don't want to say they're odd, but they're not complying for some reason. But there's also those that have COPD issues or lung type related issues that can't wear a mask. And remember, our goal is 80% compliance, but we want to be 99.9 because it will change these numbers and it will protect us. And that's not coming from me. I don't have MD or DO or whatever by my name in any way, but I am telling you, listen to the experts. I know that it'll help. And I know that that's the only bullet in the gun right now that we can fire. So I believe overwhelmingly West Virginians are doing it. Our businesses are stepping up, and all that's really good. But and I do not believe that we're going to have radical shutdowns in this state unless you pick up the nightly news and see that Florida has absolutely just washed away, or Texas has just died away, because that we can read how bad this is going to be here by just watching South Carolina, Georgia, Texas, Arizona, Florida. You can watch it happening. And if they can some way get their act together and halfway under control, we'll be okay here.
All right, thank you, Kenny. Next, we'll go to Kara Lofton with West Virginia Public Broadcasting.
Hi, everyone. Kara Lofton with West Virginia Public Broadcasting. Governor, I know that this wasn't really addressed today, but there's a big discussion. Can you give us updates on what's happening with schools in the fall?
Well, it's Kayla, is that correct? Is that right, Jordan?
It's Kara.
Kara, I'm sorry. Kara, let me just say this. I've said it over and over. I get accused of making this briefing or this update on COVID, having political, ramifications, because I've said positive things about our president, and I do think he's done a great job and I do think he's got lots and lots on his plate right now, but, I will not be pressured by our president or anyone in regard to putting our kids back in school. Today, in West Virginia, we have the plans. And, our Superintendent Birch and all the people, we have the plans, but now, if you just step back from this and just think, can we go to school today? There's no way. There's no way we could go back to school today. Now, we've got the plans to go, but would it be safe? Would we really feel in our hearts that it's safe? So from that standpoint, today, I am still struggling, and that's why we pushed this till September the 8th, in hopes of buying more time that will give us more knowledge. We pushed our sports back in hopes of buying more time and still being able to have our sporting events, only if we're going to school. Now, there's a lot of questions to still be answered. First of all, those questions to me are not answered today, and from my standpoint, today, I couldn't put us back in school. I couldn't put us back in school because I'm not comfortable about how our kids are going to fare. I'm absolutely concerned in every way about our teachers and our service personnel, and anybody that is absolutely in contact with that. I am absolutely concerned. I hope to goodness that we will be able to go back to school. I am confident as I can be that all of us as moms and dads and grandpas and grandmas, all of us want our kids back in school. But are we willing? Are we willing to take a chance today? And really and truly, if we're not, then we got a problem, and we've got to some way solve it. We'll be able to solve this, and I am confident that we will go back to school. But there's a lot of questions that have got to be answered as far as I'm concerned before we get there.
All right, thank you, Kara. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Traditionally, young people have been sort of bulletproof in their approaches to things like this. With colleges returning tentatively in about a month, are you willing to go the route of having students returning to West Virginia from outside areas go into self-quarantine for 14 days in order to protect the rest of the population?
Paul, if that be the case, absolutely. I think we've got to remember that everything's got to be on the table. Everything's got to be on the table, and we're going to be significantly inconvenienced. If that be the case, and that is the level of the extension of the inconvenience, and then we could truly have, students back on our campuses, how bad's that? I mean, really and truly, how bad is that in the scope of everything? We've got to understand that we are dealing with something that has never happened in our lifetimes. A true out-and-out pandemic. Now, and absolutely with that, if that's the worst that happens, that's not too bad. And so, I don't know all the things that are going to happen by any stretch of the imagination right now. But we know to get through this, we are going to have to get to a vaccine. And to get to the vaccine, we know we're going to be inconvenienced, and we're going to have to deal with things. And if we don't, then we better just step back and get ready for sad singing and slow walking, because we're going to have a bunch of funerals. And we can prevent an awful lot of that if we'll just listen and give it everything we have as great West Virginians.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. Mark Curtis, Nexstar Media. Governor, I received a series of photos this morning that were taken at the Greenbrier Resort, and I realize you aren't involved in the day-to-day operations there, but none of the guests or staff members, some of whom were in pretty close proximity, were wearing masks. And then I got another batch of photos from the Republican Lawyers Association that was held at the Greenbrier. And these are posed photos, so I'm going to give the folks the benefit of the doubt. Maybe they were wearing masks and took them off for the photos and then put them back on. But among those photographed in groups, House Speaker Roger Hanshaw, Attorney General Patrick Morrisey. What is your advice to the staff, the guests, and your fellow Republicans who are at the Greenbrier?
Well, first and foremost, Mark, the only time I've been there, I went over on Sunday morning to have breakfast with Dr. Jimmy Andrews. Well, I didn't have breakfast. I met him at my office over there, and I, I really met him there to try to, because he's looking after this hip situation that I've got, and at some point in time I'm going to have a hip replacement. But nevertheless, when we met, all three, he had a fellow with him, Mike Emmel, but Dr. Andrews, Mike Emmel, and myself all had masks on. Everybody that I saw around the Greenbrier had a mask on. I haven't been into the main Greenbrier for months, so I don't know the inner workings of what's going on there. But I think that I haven't seen what you're talking about. I saw on television, the tennis thing that was going on. People were sitting in the stands, they were socially distanced a long ways apart, and they all had masks on. The only people that didn't have a mask on were the players. I watched a little bit of that on ESPN, but I absolutely would take big time issue with the fact that about people at the Greenbrier not wearing masks, because I guess it's possible and everything. I'm not going to dispel it because I didn't see it, but I can tell you this: when I got to the gate, there was two people there. They both had a mask on. One was taking temperatures of everybody that was coming in the gate and everything. So that's, I would think that your information is skewed to some degree, but I don't know that.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Governor, at the beginning of your briefing today, you mentioned the call with the Mon County officials, and that you're on board with them, except for one thing, which I assume would be the bar closures. But it's my understanding that they were planning to propose some level of non-compliance penalties to you. So I wanted to ask if you can offer some more information on the content of your meeting and kind of what's your read and what they want to do. Do you agree with them or and all that? Thanks.
David, we're working through all that, and we're working through it with our health experts. We were trying to get all the details and everything. I've not seen the letter yet and everything. We were trying to get that. Dr. Marsh was on the phone with different people from WVU to the health people, and all that was happening. And Dr. Amjad was there, and we were trying to get all the information. There are some things, where I think what they're saying is if you have 3 positives at a business and everything, then they're going to close the business down or recommend closing the business down, doing all the decontamination and sanitizing, and then there's additional things that could result in much more stringent penalties as we go forward. The one thing that I'm concerned about, David, in all this is just this: when we end up having 55 different rules in 55 different counties for 55 different situations, we're going to run in a lot of different areas that we don't want to go in. And so we want to listen to all the health officials. We want to solicit their information, try to keep everybody pulling the rope together in one direction instead of people trying to push the rope, because we know that isn't going to work. And at the end of the day, we're going to work hand in hand with all these health officials and county commissions and everything to keep on doing the good work that they've already done. They've done amazing work and everything. But from an enforcement standpoint and so on like that, like I said, from the restaurants and the bars, they do have the ability to step up and monitor those situations. And we do know from the standpoint of the bars, number one area where we could get in trouble the worst.
All right, thank you, David. We have time for one more. We'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and I'll keep this short, but this goes back to enforcement, and then it goes kind of hand in hand with the mask order. Obviously, if we're going to be trying to lower the gathering limits to 25 and no more than 25 people, what's the enforcement mechanism for that? I know that I've seen in Putnam County, I think WOWK reported this, where you had the health department that was threatening to crack down on restaurants that were not enforcing the mask order. I know there's a hardware store in my hometown, St. Mary's, that absolutely is not enforcing the mask order, and they've said so publicly on their Facebook page. What are we doing about enforcement, specifically now that we're going back on these executive orders to limit the crowd sizes? Thank you.
Well, Steve, I could talk forever, and I know people will get tired of hearing me talk, but I would say the rules are exactly the same as they've been in the past and everything. From the standpoint of enforcement, like I've said, the health officials, they have enforcement capabilities from the standpoint of areas where they license. And they license, restaurants, they license bars. I can tell you this, that from the standpoint of West Virginia, period, if you go out and you walked in every store, every facility in the state of West Virginia, and I really believe that overwhelmingly we have made unbelievable progress as far as people wearing masks today versus when I was just sitting back saying, now come on everybody, come on. And I was pleading with them. Then we make it mandatory that people do wear masks, and we have seen a real pickup to the upside, an unbelievable pickup to the upside. It's exactly what we wanted. And you know why we've seen that? And I always go back to exactly this. West Virginians are smart people. They really are smart people. And now, really and truly, they got lots of stuff going on in their lives, whether it be their job or their kids or, summertime or whatever it may be. But now they really see just how critical this situation can be. And so what do West Virginians do? They step up like you can't believe. I've got picture after picture after picture on my phone of Targets and Walmarts and Go-Marts and whatever it may be all over our state and everything, where people are saying they went in and not a single person did they see a single person that didn't have a mask on. That's the good stuff. That's the really, really good stuff. And so West Virginia, you should be very proud of yourself again and again and again. But this is serious stuff. This is not playtime. People are dying, and people are getting sick, and young kids are absolutely experiencing things that they'll carry health situations or problems the rest of their life with. Sure, for the most part, kids get it. A lot of them don't even know it, and they get better. But at the same time, there are bunches that don't. And so please, West Virginia, just keep doing what you're doing. There's problems. We don't need to dwell on the fact that some hardware store owner just said, well, I'm not going to have people in here wearing masks. Sure, there's exceptions, but don't let the exceptions steal your joy. If you'll read the good book that I just mentioned so many times, our Bible that tells us so much, over and over and over, you'll read these words. Don't let anyone steal your joy. Don't let anyone steal your joy. And so at the same time, I would just say, keep doing, West Virginia, all the great stuff you're doing. Protect yourself and protect your neighbor. Love your neighbor, and don't let anyone steal your joy. God bless each and every one of you. Thank you.